had a great time in medical school. There were 14 African American students in that class, and this was back in the 70s. So it was a time when integration had not occurred throughout the South. And many of us came from historically Black colleges and universities because coming out of high school, many of us were coming from segregated educational backgrounds. When I came on campus, I met a lot of really wonderful people, and of course, Will Sanders was here at that time, and he was over the Student Minority Affairs office. Will Sanders was just a very special individual. He was on faculty here, and of course, in charge of the anatomy lab. Will opened his arms and his heart, his head to any student. He was a friend, he was a mentor, he was a father figure. He just did it all.
Being a recipient of the Sanders Scholarship just makes me want to work harder, make that person proud, and do his legacy justice. He was an inspiring man. He broke down borders, and he let me be here today. I didn't have to fight or struggle as much as he did, and I thank him for that.
Banks was a practicing physician in town, and he really encouraged the students, all students, to come over to his office, and we learned interviewing skills, and we learned how to just maneuver in private practice with him. He and his wife, LaKay, were just wonderful. They supported us and had events for us.
Receiving the Banks Scholarship and being a part of Dr. Banks' legacy really is just an absolute honor. There's a lot you can take in terms of his perseverance and his drive and his passion for the community, his passion for education, despite everything that was trying to stop him along the way.
At the time that I went to medical school, that was a sea change that the university had made back in the 70s, because there obviously was a commitment to diversity, not only in terms of race, but in gender. And it's amazing because here we are 40 years later, and you're still dealing with the same issues. There are so many populations of people. There are so many different groups who feel disenfranchised, who are hesitant to come seek medical care. So when you diversify the workforce to reflect the diversity, the changes, the differences in thought, then you have a greater opportunity to reach those pockets of people.
In 2015, the AAMC released a report that said that the number of Black males applying to med school now is lower than it was even in the 70s. As a young Black male going through college, there are a lot of different things, forces pulling you different ways, right? And there are definitely easier paths than med school. I think especially growing up in kind of like rural South Georgia in these poor areas, that medicine was not anything that anybody talked about. And so that's where scholarships like these come in. It sort of takes down one of the perceived barriers.
I came as a scholarship student, and I was on scholarships and grants. As a recipient of that support, I know how much it means, and I know how much it meant to me. I don't think I could have gone to medical school without such support. Everybody deserves a chance. Coming back and seeing students who have received scholarships, it kind of takes me back to my days in medical school, starting a new adventure, starting a whole new life when I was beginning my life and all of the possibilities. So to see young people excited about the specialties that they're considering, excited about the education that they're getting, it's a really good feeling because you know you're a part of making a change.